Prior to starting the sonographic evaluation of the hip, I find it useful to palpate certain bone landmarks to know where to place my transducer. Not on everybody can you actually palpate the anterior inferior iliac spine, but it's important that you, if capable, to feel for the bone anatomy and then draw a line to the external part of the thigh. So putting my finger onto the ilium here, I can actually feel the bone landmark, and that's going to be an important part to where I start to place my transducer. So after palpation of the bone landmark, I'm going to use either a curved linear or linear array, depending on the patient's body habitus. And in this situation, I'm going to start out with a linear array transducer. Beginning with placing the transducer on the skin in a long axis fashion to the, we'll see the ilium or the bone landmark here. Then we're going to follow it down to the acetabulum, which is this ridge-like structure. And then if I slide the transducer slightly inferior, we're going to see the rounded structure of the femoral head. So this would be the acetabulum. This would be the femoral head. Now these are going to be important landmarks to start with, and as we move superior or superficial from the area of the femoral head and keeping the acetabulum in view, we're going to see the hypoechoic structure that's in contact with the femoral head, and this is the articular cartilage that lies just superficial and in direct contact and adhered to the femoral head. Then you're going to see a hyperechoic structure, wedge-shaped structure, that sits just superficial to the area of the articular cartilage, and that is going to be the area of the labrum of the hip. And then in direct contact and superficial to the labrum is going to be the ligamental structure that makes up the capsule of the hip. And there are several ligaments that make this capsule of the hip, but important to realize that going from the bone surface more superficial, we're going to see the femoral head, the articular cartilage, the labrum of the hip, which is going to be the structure right here, then the ligament and capsular structure that sits just superficial to that. Sliding the transducer inferior and lateral, we're going to get to the area of the femoral head-neck junction, which is this structure on the screen right here. You'll see the femoral head, the femoral neck, and then just superficial to that, you're going to see the area of the anterior capsule of the hip as it comes down. Now, once we get into the area of the femoral head-neck junction, and you're going to see a bit of the shaft of the femur here, you're going to see a bright capsule appearance of the anterior capsule of the hip as it comes down onto the insertion. And this is a common area for injections into the hip using ultrasound guidance from the lateral to medial approach. It's always wise, before you do any type of injection procedure, to turn on your color Doppler to make sure that there are no vessels in the area along the guide path for your needle. Simple look of the color Doppler. Now, I want to show you what happens when we internally and externally rotate the foot. And this is the leading edge of the capsule, anterior capsule hip. So if we internally rotate the foot in, we can actually make the capsule artificially thickened. And then if we roll it back out, that would be the normal appearance of the capsule. Again, internally rotate can actually thicken the capsule and externally rotate. So you want the foot in slight external rotation.